I started sewing my own clothes when I was probably, of course, I grew up in a small town in southern Arizona, and I was, of course, a Girl Scout. And so we did some merit badges, but we also were involved in something called 4-H, which is kind of a rural program. You can either raise cows or stuff. But I made clothes, and so I started sewing my own clothes when I was just very young, and I continued to do that all through college, and pretty much stopped when I was in medical school, just because there was not a lot of time to continue that. So the ability to do things with your hands, whether it's playing the piano or creating, in some sort of drawing or painting or sewing, I think it does give you an edge up when you start thinking about the aesthetics of the human body and what you want to do and what's going to work and what's not going to work. What really ends up making you a better surgeon or a good surgeon is, of course, practice, but also the ability to reflect and to think about your own ability to express that artistry through that other person. So it's a really it's a combined effort, because what you have to do is you have to really find out what's at the heart of what is bothering the other person, and then you have to realize what the constraints are within the confines of what you want to do. Let's say it's a tummy tuck or a breast augmentation. Those are things that through your interactions with the patient, you ultimately get to what that patient is going to not only want, but what their budget's going to be able to afford and what they're going to feel comfortable in doing.